All right, here we go. Hello, and thank you for watching this program on how to create a Medicare billing and coding compliance manual. There's no audio taping or video taping allowed, and any unauthorized reproduction, dispensing, forwarding, or copying of this target coding presentation is illegal. The information in this presentation is for educational purposes. It's not intended to be a substitute for your thorough clinical decision making. Target Coding is not a law firm. We don't provide legal services. CPT is a registered trademark of the AMA, and every attempt has been made to make certain that the information in this presentation is 100% accurate. However, it's not guaranteed. Just a little bit about myself before we get going. My name is Dr. Marty Kotler. I'm a chiropractor. I'm a certified professional compliance officer. I'm a certified billing and coding specialist. My areas of expertise include compliance as it relates to CPT coding, billing, Medicare, HIPAA, record keeping, and creating compliant cash plans. I've written many documentation training manuals on chiropractic, physical therapy, and acupuncture services. I write articles to numerous publications and journals throughout the country like Chiropractic Economics, the American Chiropractor, Dynamic Chiropractic, the American Academy of Professional Coders. Plus, I write articles for many state association newsletters throughout the country, and I'm a guest speaker at many state association conferences. Okay, so creating a Medicare compliance manual is based on information from the OIG. You could look at OIG as an organization that oversees Medicare services and other federally funded programs. So the mission of the OIG is to protect federally funded programs from getting ripped off, from getting scammed. The OIG prevents criminals from getting paid for services that weren't rendered. So it's a big job that the OIG has because there's so much fraud that occurs. So again, the OIG, which stands for Office of Inspector General, is there to protect federally funded programs. Now, chiropractic is a service that's covered by Medicare. Physical therapy is a service covered by Medicare. So the OIG looks at chiropractic physical therapy very closely to see if the services are being rendered properly and payments are being rendered compliantly. There have been many OIG reports. The OIG does investigate to see how things are going, and they've created many reports over the years. This is many years ago. The OIG said there were inappropriate payments made to chiropractors for Medicare services. And here's another one from September 2015. So there have been quite a few for chiropractic. This one is for physical therapy services. The OIG investigated a New Jersey physical therapy center and found out that they improperly received $29 million. So they were refunded. This rehab center had to refund Medicare $29 million. That's a lot of money. And there's another one that came out that said hundreds of millions of dollars paid to chiropractors that didn't comply with the requirements. So these are the things that are put out there. So we need to be proactive. That's what Medicare, the OIG, wants us to be, proactive, especially when it comes to billing and coding. A Medicare compliance manual is all about preventing billing and coding errors. That's it. It's about preventing billing and coding errors. Medicare compliance is all about billing and coding. Now, don't confuse Medicare compliance with HIPAA. HIPAA has nothing to do with billing and coding. HIPAA, which I'll touch on a little bit later, HIPAA is about protecting patient information, private patient health information. It has nothing to do with billing and coding. Medicare compliance is all about preventing billing and coding errors. So why do you need a Medicare policy and procedure manual? Not because I say so. It's required. Even if you see one Medicare patient, now, because most chiropractors that I work with, they don't see tons of Medicare patients. Maybe 10% of their practice is Medicare. Um, I would say the average, is about 20% of the practice is Medicare. I have some clients where 95% of their practice is Medicare. And then I work with some doctors, they don't see any Medicare patients at all. But even if you see one Medicare patient, you are required to have a Medicare policy and procedure manual. I'm not saying it. This is what the federal government says. This is mandatory. It's part of our laws, rules, and requirements. If you don't believe me, just ask your state board. Ask any qualified, certified compliance consultant if a Medicare compliance manual is mandatory. It is. But listen, I know that you go out on the highway, if the speed limit is 70, most people are going over 70. I get it. I understand. So this this presentation is about doctors that want to prevent problems. This program is about doctors that want to take it to the next step and protect their practice. So a Medicare policy and procedure manual is important. For example, if you got a knock on the door, or if you were audited, or a state board came breathing down your neck and they said, how do you prove that you make formal efforts to prevent billing and coding errors? See, that's being proactive. That's something that you're required to do. You have to prove that you make formal efforts to prevent billing and coding errors. Now, some of you might say, well, we go to seminars and, we go to CE classes and we listen to speakers, and yeah, I think we're doing a good job. But that's not enough, unfortunately. It has to be in writing. So a billing and coding policy and procedure manual can provide the proof that you make formal efforts to prevent billing and coding errors. And it's based on these 7 compliance essentials. So let me get into showing you examples of what it's all about regarding a billing and coding policy manual. It's based on these 7 essentials. Now, I highlighted the 3 major ones. Number 1 is written policies and procedures. Number 2, conduct regular staff trainings. Number 5, conducting internal patient record reviews. Yes, you need to do all 7, but I'm going to focus on those 3 because those are the ones that are most questioned and, in my opinion, are the most important. Yes, they're all important, but those 3 are important. So this is an example of the cover page of a policy and procedure manual, the one that we put together, the one that we supply to hundreds of chiropractors throughout the country and acupuncturists and physical therapists, is based on these 18 policies and procedures. But I mentioned, those 3 major ones, having formal staff trainings. Many of you probably have staff trainings. You'll get together. Okay, everybody, let's gather around. Maybe you have like a pre-shift huddle. That's what, I used to do, and a lot of my clients do. Before before the patient, let's say you're going to start seeing patients at, 9 a.m., you might get together with your staff at 8:30 and have a pre-shift team huddle where you go over the plan. Okay, yeah, you do that all the time, right? A lot of staff members have meetings. Do you write that down? That's all you need to do. Jot down, make it formal, jot it down in a log. Here's a sample log. So I got together with Allison, Cindy, and Ellen, my 3 CAs, on January 15th. We spoke about deductibles and copays, 30 minutes. A couple of months later, I got together with my associate doctor, Dr. Smith, and Ellen and Cindy, and we spoke about Medicare compliance for an hour. Next month, on April 15th, got together with Allison and Cindy and Dr. Smith. We got a new x-ray machine. We got a digital x-ray equipment. So we had to have a training on who's going to do it and how to develop all the information and the software. We had a training on that. That was on April 15th. We did that for 30 minutes. So log these trainings in. Next item on that list of those 7 things, the 3 that I highlighted, was the second most important on the list was doing internal chart reviews. This is what we use. We have an Excel spreadsheet that we've put together, and the provider just goes down the list. Do a routine visit. Is the patient's name and date on the SOAP note? Yes or no? Did you put down the subjective complaints? Did you put down the part exam? Did you note the subluxation findings? Did you put together an assessment? Um, did you use the right modifiers? AT for active treatment, GA if you have a signed ABN form on file. Do you have a signed ABN form on file? What option did the patient choose? Option 1, yes or no? So you just have these questions. So that's how you would do an internal chart review. The other thing that you're supposed to do is go to the exclusions.oig.hhs.gov website, put your name in, and see if you are excluded from the Medicare program. You see, if your name pops up, you're not allowed to see Medicare patients, and if you do, you'll have to give all the money back. So let's say you want to hire Douglas Godfrey. You see on your screen, he's a staff person you want to hire. Before you hire Douglas Godfrey, you're going to put his name into this website. If his name pops up that he has been excluded from the Medicare program, in this case, his license was surrendered. His license was taken away. So he's not allowed to see Medicare patients. Let me ask you a couple of questions regarding Medicare. Can you treat Medicare patients without being enrolled in the Medicare program? The answer is absolutely not. You have to be formally enrolled in the Medicare program, which means you have to be billing Medicare for patients. If you are a doctor saying, or a staff member that's saying, wait, what did he just say? We see Medicare patients, but we don't bill Medicare. I don't think we've ever billed Medicare. The doctor, I don't even know if the doctor has a Medicare number. We just tell our Medicare patients, come on in. We're not in Medicare. It was $60. Lie down. We're going to give you an adjustment. We're not going to bill Medicare. The patient just pays us cash. You're saying that we cannot do that, Dr. Kotler? Yes, that's what I'm saying. That is illegal. You cannot treat Medicare patients without being enrolled in the Medicare program, actively enrolled, and you must bill Medicare for spinal manipulation. So the answer to number 1 is no, you cannot treat Medicare patients without being enrolled in the Medicare program. Number 2, can chiropractors opt out of Medicare? No. Opting out is a private contract. Chiropractors are not on the list of providers that can opt out. Next, can you collect cash from Medicare patients without billing Medicare? Maybe. First, you have to be enrolled. Next, if the patient gets to wellness and they check option 2, there you go. Now you have a cash patient. You don't have to bill Medicare. Regarding opting out, if you want to dig into this a little deeper, some people, when I say this, they get a little nervous or they don't necessarily believe me. I understand. If you're hearing something that sounds unusual, you should be skeptical. Check into it. If you don't think that it's true that chiropractors cannot opt out of Medicare, go to the Medicare Benefit Policy Manual, Chapter 15, Section 40.4. You could read more up on that. And here's another item. This is right from Medicare. It says doctors of chiropractic may not opt out of Medicare, noting opting out and being non-par are not the same thing. Chiropractors can be par or non-par with regard to Medicare, but they may not opt out. So you have a choice. Well, you should ask yourself, do you want to see Medicare patients? Yes or no? If the answer is no, then just stop seeing Medicare patients totally. Totally. That means you cannot take cash. They cannot lie down on your table and get an adjustment. If you don't want to see Medicare patients, they should not be allowed through your front door. Now, if you want to see Medicare patients, which most of you do, I'm assuming, if you want to see Medicare patients, get enrolled. Now, if this is another thing I hear, I'd like to clarify. Some chiropractors say, yeah, Dr. Kotler, we're not in Medicare. We don't deal with Medicare. We just have patients come on in and they sign the ABN form and we just charge them cash. You're not allowed to do that. If you're not formally enrolled in the Medicare program, you're not allowed to use the ABN form. I know that sounds a little weird, but Medicare says if you're not part of our team, If you're not formally enrolled in our program, you can't use our forums. You can't use our stuff, so to speak. So again, this might sound new and different. You might go, what? I never heard that before. Go check it out. Go to the Medicare Claims Processing Manual, Chapter 30, Section 50.3. All right, getting back to the Billing and Coding Policy Manual, let me give you some sample policies. Here's a sample policy on doing an internal review. It says the backbone of any compliance plan is reviewing and monitoring components. It is our policy to perform regular reviews. If any, and that's the policy. The procedure is, if any significant issues are identified, we're going to take care of it. What we use as our guidelines to do reviews are the chiropractic guidelines, the difference between active treatment and maintenance care, proper use of modifiers. Here's another policy. This is the exclusions and background check. Again, this is not optional. This is mandatory, even if you see one Medicare patient. I know for some of you, for most of you, this might be like, what? We have to do this? Yes, I know. I don't necessarily like sharing things that you go, what? Another thing we need to do? Wait a second, Dr. Kotler. You're telling us this is something, another thing that we have to do? Yeah, sorry. I'm not here to win a popularity contest necessarily. I'm here to show you what you're supposed to do. And if you do it, you could sleep better at night. If you do it, you'll feel more comfortable. It's mandatory. This is not optional. You need to go to the exclusions list, put your name in the list, and hopefully it doesn't pop out. If it doesn't pop up, then print out that sheet and put it in your manual, and that's your proof. And it needs to be done on every single staff member. This is not just the doctor. Staff, yes, CAs, you need to put their names in to the exclusions list also. A little bit about Stark. If you own a facility, well, if you own two facilities and you refer a patient from one facility to another facility that you have ownership in, you might be violating Stark. If you're referring for DHS, Designated Health Services, careful with that. Per-click arrangements are also included. And anti-kickback, careful. If you're not allowed to pay someone for new patients or have them pay you to refer you patients, for example, if an attorney approaches you and says, hey, we get a lot of patients coming into our law firm, we're going to refer patients to you. But here's the deal. Every time we refer you a patient, you got to give us a kickback of $200. Don't do that. Or let's say you're a very, very, very busy. I have some clients, they see over 200 new patients a month. Yes, some of you don't get 200 new patients in a year. I have some clients that are getting over 200 new patients per month. So you're not allowed to say to an attorney, hey, Mr. Attorney, we get 200 new patients a month. We're going to refer patients to your law firm. Every time we refer a patient to your law firm, you got to give us $300. You can't do that. So there's a good reference for anti-kickback, and it shows you the safe harbors. Here's another policy you should have: a compliance concern. An employee. Here are the policies. Our policy is that all employees have the means of reporting some sort of potential compliance concern. Now, we're not talking about a staff member that says, hey, Dr. Kotler, we need new carpet in the waiting room, or, I think we need to paint the office a different color. We're not talking about that type of a concern. We're talking about a staff member that comes up and says, I think we're billing fraudulently. You would be shocked. I just got a client of mine. I'm not sure what he's doing, but he showed me a resignation letter from one of his CAs. The CA typed up this 2-page letter listing all the things that she feels the doctor is doing wrong. She has some major compliance concerns, accusing the doctor of billing fraudulently. That's different than, we need to change the, the carpet in the waiting room. So there's a formal procedure that needs to take place if an employee has a compliance concern. Here's just, you might have a list. So we put together a list for doctors. Let's say you do full spine adjustments, but you only bill 98940. Explain that. Tell them that you analyze the entire spine, or put that. You don't have to tell anybody. Just put it in your policy manual that you analyze the entire spine on every visit. and you only bill for medically necessary services. We have a very expanded description of that, but that's the gist of it. Every patient that comes in, you do a full spine analysis. You may adjust multiple segments of the spine, but you only bill for the medically necessary regions. You should have a policy on that. You should have a policy on time-based codes and open therapy rooms. It's good to have a policy manual. Why? For your staff. They want organization. They want leadership. Your staff wants to work in an ethical, trustworthy atmosphere. Whenever I bring on a client and I'm training the staff and they go, whoa, I don't think we're doing that right, it just makes the entire office look bad. Billing policy manual for insurance companies and state boards, absolutely. It could prevent audits and mitigate fines and penalties. And for the doctor, it'll help you sleep well at night. So I mentioned this earlier, Medicare versus HIPAA. Medicare is about preventing billing and coding errors. HIPAA is about protecting patient information, like their credit card information, their address, their social security number. So how do you provide proof that you make formal efforts to secure patient health information? Well, that's all about HIPAA. HIPAA applies to covered entities. Are you a covered entity? I'll ask you a couple of questions. Do you bill insurance or receive payment from insurance companies? If the answer is yes, you're considered a covered entity. If you submit claims electronically, you're considered a covered entity. So yes to either one of those questions means you are a covered entity and you have to abide by all the HIPAA rules. Again, Dr. Kotler, that's what I hear. Again, another thing we have to do, yes. You know what's funny? I hear doctors say this all the time. They contact us just about every day. Doctors saying, and staff members contacting us, we heard about you, Dr. Kotler, or we heard you speak at a seminar. We want to hire you to make sure we're doing everything right. I hear that all the time. Every time I do a seminar, on the breaks, doctors come up to me and go, wow, I'm learning a lot. Can you help me? I just want to make sure I'm doing everything right. And then I explain to the doctor or staff member what it takes to do everything right. And then things change a little bit. You want to do everything right, have a good HIPAA notice. This tells you exactly what should be provided to a patient. You know, that HIPAA notice, that notice of privacy practices that you give a patient. Every new patient needs to fill one of these out. If yours is outdated and old, meaning if it's written prior to September 13th, throw it out. It's garbage. You don't have the right information. Make sure you're using the right forms. Make sure you read your forms. The patient doesn't necessarily have to read it, but you should and your staff should. Make sure, you know, I was reading, one of my clients sent me his HIPAA notice to review. He didn't read it. His staff didn't read it. I read it. He had a lot of dental information in it. He just took his brother-in-law's a dentist. He just took his HIPAA notice. That's what he's been giving to his chiropractic patients. So make sure you read, you know, there's policies and procedures for HIPAA. This is a sample termination policy. If you fire a staff member, they quit, there are certain things that it's mandatory that you need to do. You have to document it in a HIPAA manual. Now, if you want to do HIPAA on your own, you could start with this website. This is an excellent resource, HIPAA for healthcare professionals. HIPAA requires a security risk assessment. If you don't want to hire anybody to help you, you can go to this website. It's a good resource. And, you know, just become proactive. You know, you want to prevent problems. Action steps. Read the policies from all the insurance companies you bill. We actually, if you have a Medicare compliance manual created by us here at Target Coding, we give you the insurance company policies from all the plans you bill. So you don't have to go searching for that. We provide that to you. We show you how to train staff, and we give you the training logs. You should attend seminars, webinars. You know, in general, a policy manual is going to prevent audits. It's going to help you sleep better at night. We worked with a doctor that was being audited, there was a Medicare audit, and after we went through the Medicare compliance training manual, the doctor was able to improve efficiency. There were some visits where the doctor was doing something in the back of the office, but the front desk CAs were not picking up on what the doctor was doing. They were losing money. So with this policy and procedure manual, it actually helped improve office efficiency. So just a few closing comments. Please check with all the plans you build to make sure everything's compliant. You know, things change all the time. So stay on top of the changes, attend seminars, attend webinars. Here's our contact information. You know, please follow us on Instagram and Twitter and YouTube. We have a YouTube channel. Like us on Facebook. Here's our contact information. If you go to Instagram and you follow us on Instagram, we're taking $100 off a compliance manual. This is what we do here at Target Coding. Besides creating compliance manuals, we do seminars all over the country, webinars, obviously. We have 15 training videos that we sell. We do on-site consulting. We have membership programs. We do hourly consulting. If you just need to pick our brain for an hour, we can do that. It could be from an hour all the way up to an on-site training with your entire staff. That's the range of services we provide. We have a forms, letters, and templates package. We offer HIPAA compliance programs, Medicare compliance programs. Our Medicare compliance manual consists of creating personalized policies and procedures for your practice. You get all of our forms, letters, you get all the carrier policies, training on the $75 rule, prompt pay discounts, chart audit tools. Our HIPAA manual includes a cloud-based storage portal for all your HIPAA policies and procedures, business associate tracking. You have about 20 training videos that your staff can watch, and they can get a little certificate of completion. Very nice. Again, this is mandatory. It's not optional. I'm not saying it to scare you. I'm just saying it to educate you. Now, some of you might say, Marty, we don't see Medicare patients. Fine. You should just get a general billing and coding compliance manual. We create compliance manuals for Medicare and non-Medicare practices, for physical therapists, for acupuncturists. Here's our acupuncture policy manual. Yeah, we also offer memberships. This is an excellent book that I wrote. It's been updated with all the new ICD-10 codes. It's the guidebook on the best chiropractic ICD-10 and CPT codes to improve reimbursement. This is one of my favorite sections of the book. We give you a whole bunch of common diagnosis codes, and we tell you what are the subjective ortho, neuro, and chiro tests to do to support the code that you pick. See, years ago, maybe even some of you are doing it today, a patient walks in with back and leg pain and you just diagnose sciatica. That doesn't work anymore. You have to do certain ortho neuro tests if you want to protect yourself. For example, if you are going to diagnose a patient with cervical brachial syndrome, take a look at the bottom of the screen. Do Wright's or Atson's, 1 or 2 ortho tests. Check for myotomal weakness, forward head posture, palpatory tenderness, subluxations, neck and arm pain. Oh, this is another nice section of the book where we talk about, I've been gathering questions over the years. And these are questions that even if you're in practice 20 years, you might not know the answer. So it's a good little educational tool, like what's the difference between a disc disorder and a disc displacement? Very important in ICD-10. What's the difference between radiculitis, radiculopathy, and myelopathy? What's the difference between cervical brachial syndrome and cervical radiculitis? What's the difference between spasm and contraction, myalgia, myositis, myofasciitis, myalgia, myositis, myofasciitis, a lot of itises there. What are the diagnosis codes that will pay for the most visits? We provide that too in this book, and how to pair your codes, cheat sheets. Our seminars, most of our seminars are CE approved. Actually, we have a physical therapy webinar coming up on March 22nd. We're going to be going over the new Medicare therapy cap for those of you that employ PTs. Major change occurred with the therapy cap. We go through clinical examples. We go through every CPT code that a typical physical therapist would use, and we give you sample SOAP notes. And if you can't make this webinar, if you make the live, great. Even if you make the live, we're sending you the recording. You just want the recording, you could attend the live. You get both for the same fee. And then we're doing the following week, we're doing an acupuncture webinar. We're going to go through all the acupuncture codes, 15-minute increments versus the 8-minute rule, very important. And what do you do during those 15 minutes? We're going to give out some sample acupuncture SOAP notes A lot of people attend this webinar that are thinking about bringing on acupuncturists. Acupuncturists are hidden gems. In many states, acupuncture is paid by insurance, and it works very well. It's underutilized, in my opinion. So, also, live and recorded. You get both for the same price. So, just want to thank everybody for attending. Again, here's our contact information, info@targetcoding.com. Website is targetcoding.com. Telephone number 1-800-270-7044. Our HIPAA secure fax number is 1-844-831-2347. Just want to thank everybody for attending. I hope you learned a lot.